Well, it was very striking for me when I saw this data, and it became very clear to me that we have to tell people what the data is telling us and has been telling us more and more firmly for years, which is that there's a causal link between alcohol consumption and cancer risk. And we put out this advisory calling not only for more public education, but for a change to the alcohol warning label. There's a Surgeon General's warning on alcohol bottles, which currently warns people about drinking while they're...
The U.S. Surgeon General Advisory has long been a trusted authority in public health, committed to raising awareness about preventable health risks. Recently, the advisory has focused on the undeniable link between alcohol consumption and cancer. While alcohol is often considered a harmless social drink, the U.S. Surgeon General, Dr. Vivek Murthy, has compiled alarming data revealing its direct connection to cancer. This important information challenges the common perception of safe alcohol consumption and highlights the need for greater public awareness. In this video, we'll discuss 4 common questions about alcohol's cancer risk, answered by the U.S. Surgeon General Advisory. These insights will reveal shocking facts about how alcohol-induced cancer and the factors affecting this risk. But before we explore these key questions, let's first understand why it's so crucial to recognize alcohol's role in cancer development. Cancer is a devastating disease that occurs when healthy cells begin to grow uncontrollably, forming tumors that spread throughout the body. Alcohol, often overlooked, plays a significant role in the development of several types of cancer, including those of the breast, liver, mouth, and throat. By understanding the profound impact of alcohol on cancer risk, we can make informed decisions and take action to protect our health. But before we continue, this content is provided for informational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. Always consult a qualified healthcare provider for questions about your health or medical condition. Do not disregard professional advice or delay seeking it because of something you have read here. Now, let's take a closer look at these important questions, revealing the truths behind alcohol's link to cancer and how understanding this can help protect your future. Does alcohol increase cancer risk? Did you know that alcohol is one of the most commonly consumed substances worldwide, yet many people don't realize its connection to cancer? This question is critical because understanding the relationship between alcohol and cancer can empower you to make informed choices about your health. For years, alcohol has been associated with immediate risks like accidents or liver damage. But what about its long-term effects? The Surgeon General's advisory shines a light on something many people might not know. Alcohol is a proven carcinogen. Yes, the same way tobacco or asbestos is categorized.
The HHS saying in a statement that alcohol is a well-established preventable cause of cancer, responsible for about 100,000 cases of cancer and 20,000 cancer deaths annually in the United States.
Alcohol consumption is the 3rd leading preventable cause of cancer in the United States, following tobacco use and obesity. In 2019, an estimated 96,730 cancer cases were directly related to alcohol consumption, with 42,400 cases in men and 54,330 cases in women. This translates to nearly 1 million preventable cancer cases over a decade in the U.S. alone. The largest burden of alcohol-related cancer is seen in breast cancer, with 44,180 cases in 2019, making up 16.4% of the approximately 270,000 total breast cancer cases for women. Over the past 2 decades, numerous high-quality observational studies and meta-analyses have established a clear relationship between alcohol consumption and increased cancer risk. In a pooled analysis of 26 studies, it was shown that people who consumed about 1 drink daily had a 40% higher risk of mouth cancer compared to non-drinkers. Similarly, a study of over 1 million women found a 10% increase in breast cancer risk for those who drank up to 1 drink daily. Crucially, this relationship holds true across different types of alcohol, beer, wine, and spirits, highlighting that the risk is consistent regardless of the alcohol consumed. This body of evidence strongly supports the conclusion that alcohol is a major risk factor for various cancers. So, does alcohol increase cancer risk? The answer is a resounding yes. Now that we've established alcohol does increase cancer risk, let's dive deeper into how alcohol actually causes cancer. Before we move on, if you are looking to dive deeper into the causes of cancer, be sure to subscribe to the QuickTime newsletter linked below. Each week, we share expert-backed tips, delicious recipes, and actionable steps to help you live longer and feel your best delivered right to your inbox. How does alcohol cause cancer?
Well, I think there certainly needs to be much more public awareness, and I think that what we need to think about is how the overall impact of alcohol in our health should factor into decisions about, about how we encourage.
Alcohol is everywhere, in social gatherings, celebrations, and even quiet nights at home. But how does something so common contribute to cancer? This question matters because understanding the biological link between alcohol and cancer can help clarify why even moderate consumption carries risks. When you drink alcohol, your body works to process it. However, this process leads to the formation of a dangerous chemical called acetaldehyde. Acetaldehyde is a known carcinogen, meaning it has the potential to cause cancer by damaging your DNA. Damaged DNA interferes with how cells function and repair themselves, which can eventually lead to uncontrolled cell growth, which is the hallmark of cancer. But it doesn't stop there. Alcohol also increases the levels of certain hormones, like estrogen, especially in women. Elevated estrogen levels are linked to breast cancer. Additionally, alcohol irritates the cells lining the mouth, throat, and digestive tract, making them more susceptible to damage and inflammation. Over time, this irritation can trigger cellular changes that develop into cancer. To complicate matters, alcohol also weakens your body's ability to absorb essential nutrients like vitamins A, C, D, and folate. These nutrients are crucial in repairing damaged cells and maintaining a healthy immune system. Without them, your body's defenses against cancer are compromised. So, how does alcohol cause cancer? It's a combination of factors including acetaldehyde production, hormonal changes, tissue irritation, and nutrient depletion. These mechanisms work together, increasing the risk of various cancers, including those of the mouth, liver, breast, and colon. Understanding this connection is vital because it shows that the impact of alcohol goes far beyond short-term effects. It directly disrupts the delicate processes that keep our cells healthy, paving the way for cancer development over time. Unveiling the mechanisms behind alcohol's role in cancer leads us to the next question. Which cancers can be caused by alcohol? Most people associate cancer risks with smoking or genetics, but alcohol? It's often overlooked. This question is crucial because understanding which types of cancer are linked to alcohol can provide clarity and underscore the importance of prevention. The Surgeon General's advisory reveals a sobering fact. Alcohol is linked to at least 7 different types of cancer. Each of these cancers impacts vital parts of the body, and the risks are present regardless of how much or how little you drink.
Whether you prefer beer, wine, or spirits, the report says the increased risk of cancer is the same. It also found that alcohol can increase at least 7 types of cancer, including liver, breast, and colorectal cancer. The Surgeon General says it was important to release this information because the report also found that only 45% of Americans were aware that alcohol consumption increases their risk of cancer.
Let's start at the top. Alcohol consumption is a leading cause of cancers of the mouth, throat, and esophagus. Why? Alcohol irritates the cells lining these areas, making them more vulnerable to damage and mutations. Then there's liver cancer. Your liver is responsible for breaking down alcohol, but in doing so, it produces acetaldehyde, a toxic byproduct that can damage liver cells and lead to cancer. Alcohol is also strongly linked to colorectal cancer, one of the most common cancers worldwide. Studies show that drinking increases inflammation in the gut and impacts the healthy bacteria that protect your digestive tract. For women, breast cancer is another significant concern. Even small amounts of alcohol can elevate estrogen levels, which can fuel the growth of hormone-sensitive breast cancers. So, which cancers can alcohol cause? The list includes mouth cancer, throat cancer, esophageal cancer, liver cancer, colorectal cancer, breast cancer, and even a rare form of voice box cancer. While the causal relationship between alcohol consumption and cancer is firmly established, further research is being done on the potential effect of alcohol consumption on increasing cancer risk at additional sites such as skin, prostate, pancreas, and stomach. These findings highlight an undeniable truth. Alcohol affects multiple parts of the body, and its impact is far-reaching. Recognizing these risks is the first step toward making choices that protect your health. Now that we know the types of cancer alcohol is associated with, let's explore how the amount of alcohol you consume influences your risk. How does the amount of alcohol you consume affect your risk of cancer? It's common knowledge that moderation is key when it comes to most things. But when it comes to alcohol and cancer, is there really such a thing as a safe amount? This question is essential because it helps answer how our drinking habits can influence our cancer risk.
Dr. Murthy warns drinking even moderate amounts can put you at a greater risk for disease, saying, quote, the risk of developing cancer may start to increase around 1 or fewer drinks per day. In fact, a recent Canadian study found just 2 drinks a week can take 2 to 3 days off your life. That jumps to 2.5 months if you consume 7 a week.
The Surgeon General's advisory makes a critical point. The more alcohol you consume, the higher your risk of developing cancer. But the connection isn't as simple as just drinking heavily. Even light to moderate drinking can elevate your cancer risk, with the risk growing as your alcohol intake increases. Here's how it works. Alcohol consumption doesn't just increase your chances of one specific type of cancer. It affects your body's ability to repair and maintain healthy cells, leading to a higher likelihood of damage to your DNA. This damage accumulates over time, raising the risk of cancer in various organs. Research shows that even people who drink within the recommended safe levels still face increased risks of certain cancers. For women who consume less than 1 drink per week, the risk of breast cancer is approximately 16.5%. However, this risk increases to 19.0% for those who consume 1 drink daily and rises to 21.8% for those who consume 2 drinks daily. This represents a 5 percentage point increase in risk for those consuming higher amounts of alcohol. And as the amount of alcohol consumed rises, so does the risk, and more frequent drinking or binge drinking compounds the danger. In contrast, long-term quitting or reduced drinking is associated with lower risks of some alcohol-related cancers. A recent evidence review conducted by the International Agency for Research on Cancer concluded that alcohol cessation or reduction decreased the risk of mouth cancer and esophageal cancer. So, how does the amount of alcohol you consume affect your risk of cancer? It's straightforward. The more you drink, the higher the risk. Even light to moderate drinking can raise your chances of developing cancers like breast or colorectal cancer. The key takeaway is that reducing alcohol intake can lower your overall cancer risk, and there's no truly safe amount when it comes to long-term health. That is all for the 4 common questions answered by the U.S. Surgeon General's advisory on alcohol and cancer risk. This advisory gives us critical insights and the opportunity to make informed decisions for a healthier lifestyle. Cancer is one of the fastest growing diseases globally, and we can only combat it by making empowered choices and adopting healthier habits. Remember, prevention is better than cure. So, join us in the next video to learn about the 5 drinks that can reduce your cancer risk naturally.